Racism, a public health crisis. That's what state leaders think. It's Friday evening. I'm Tyler Lopez.
And I'm Amber Kriska. They are working to stop it in a 5-part plan. Madison Porter joins us live in the studio with a look. Madison?
Amber and Tyler, the state health department is required to send out a 5-year improvement plan every 5 years. This year, I went through it, and there are 5 priorities, one being to announce racism as a public health crisis.
I think, to put it in tangible terms, it shifts the focus away from the individual level and individual responsibility, and instead puts that focus on systems and structures.
Jennifer Epstein with the Department of Public Health says the goal with this 5-year plan is to develop a diverse structural workforce to address and eliminate practices that support racism, which ultimately leads to poor health outcomes for minorities.
You know, we're seeing Black and African American people in Illinois continue to have the lowest life expectancy at birth and experience higher mortality rates from heart disease, cancers, diabetes, and COVID-19.
And to identify and declare racism as a public health crisis, she says will move them towards achieving the goal of equitable access.
You know, access to care and good health should not be determined by where one lives, where one works, or the color of one's skin.
As the state works on declaring racism as a public health crisis, the Peoria City County Health Department is one of 8 entities in the state that already has.
And so what it will do is affect those who are low income, poor people, and specifically Black people in Peoria, which we are 27%.
Marvin Hightower, the president of Peoria's NAACP, hopes it will lead to real care for the real people who need it.
So hopefully through policy, that will establish an equitable distribution in the healthcare field.
Now, in this 71-page plan, the state's Department of Public Health also plans on focusing attention and resources on chronic diseases, COVID-19, maternal and infant health, mental health, and substance use disorders too. This plan is scheduled to be strategized and in place by 2028.